everyone. Welcome back to my YouTube channel, Global Nurse Stories. Yeah, today I have another guest in the house. She's a registered nurse and she's a virtual registered nurse. Yes, you heard me right. Virtual nurse. Yeah. So I'll leave her to introduce herself. She's a good friend. No longer a friend, she's a sister. And today she's here to share her experience. She's in the United States and she's a virtual nurse. She's working as a virtual nurse. Over to you,
Hello,
Granny.
everyone. Hello, everyone. Good afternoon, maybe good evening, good morning, wherever you are in the whole world. My name is Damilola Boduri. I'm a nurse. I'm an immigrant nurse in the USA. I've been a nurse in Nigeria before I came to the United States. And I've worked in different aspects of nursing. It's a vast experience. And currently, I'm working as a virtual nurse. So thank you for having me here. Blessing is actually my sister from another mother. Thank you so much, and thank
Yeah.
you for what you're doing.
Oh, thank you. Thank you for granting my interview.
You're
So,
welcome.
so to my first question, can you describe your experience working as a virtual nurse? How do you engage with patients, working with them remotely? Because what I understand as a virtual nurse is that you are talking to the patient through video, audio connection, not that the patient can touch you, if I'm right. But if I'm wrong, you
Yes,
can
you're right.
correct me. So, how do you engage with patients, like relating with patients in that aspect using
Okay.
technology? So, how do you engage with them?
Okay, this is a question that is common whenever I tell people I work as a virtual nurse. So the first question is, how do you do it? So, as a virtual nurse, we are not actually physically in the hospital, but we do engage with patients through. There is the system we use. We have desktop, we have computers that are connected directly to the patient room. So we engage through that platform. So we work from the office and we talk to our patient through our desktop, our computer using video conferencing. And the patient in the hospital hears us through his own television system in the hospital setting. So that is how we do engage with our patients.
Wow. So, is there anything you do differently? Like, do you still introduce yourself the way we do at the bedside? That whole good morning, my name is Blessing. I'm going to be your nurse today. Stuff like that.
Yeah, good question. Good question. You know, we are in an environment where we have patient rights. You can't just tread upon their rights. So we call something virtual knock. So there is a way in our own system. There's a way we knock. Like when you want to enter a patient room in the physical environment, you knock the door, and sometimes you want to even say, "Nurse coming in. I'm going to put on the light." Something like that. So for us too, we also knock. Although we are not
Wow.
knocking physically, we are knocking virtually. So we knock, then we speak to the patient, we introduce ourselves, we let them know the purpose of our call, we tell them what we want to do, and we take consent before we come on the camera. So the patient has a choice. They could either say yes or they say no. So the choice of the patient is the final say. If they say yes, then we are able to come up on the screen for them to see us, and then we connect from there. But if they say no, then we stay blank. You can't just batch into their room. They have their privacy. So
Wow.
that is it. So we also have virtual knock, and we respect patient privacy. It's priority to us.
Wow, technology has gone a. So you do virtual knock. I'm hearing it for the first
Yes.
time. And thank you for sharing.
Yeah,
Thank you.
we do that.
That's interesting.
Yeah.
So now in the hospital setting, we have people that will say, I'm working in med-surg, I'm working in L&D, I'm working in psych. So do you also have specialty as a virtual nurse, or you can work with any patient?
Yes, as virtual nurses, I wouldn't say it's like a specialty, but we also work on all these floors you just mentioned, like med-surg, orthopedics, oncology, psych, mother and baby. We work on every floor. You might not have specialty like I'm specialized to work with mother and baby or as an orthopedic nurse, but you can work on those floors once you are a registered nurse. So we work on different floors, but they have different programs for different floors, and and for example, we work with patients that are palliative care. So the way we are going to treat a palliative care patient as far as virtual nursing is concerned is different from the way we're going to treat a med-surg, alert and oriented patient. So sometimes for palliative care, there should be a communication between the virtual nurse and the bedside nurse. So the bedside nurse could give us information on when to go in, when is it appropriate. Do you understand? So for palliative care, most of these patients, sometimes they have cancer patients that are in pain. You don't want to go in at the wrong time. And you don't want to do a virtual knock at the wrong time. So the best I know that I've seen them physically, that know the state of their health at that time, and if they be able to answer questions, will give us information. So we work according to the floor. So we have different programs for different floor.
Okay, so let's go to certification and the yearly requirements as a nurse. So in the hospital, because of the units you have, there are some CEs that you have to do yearly for you to be proficient in that area. Does it mean for your side that means you have wide range of CE that you have to do?
Yes, that's one of the things. I won't call it a challenge. I'll call it um continuous education. I don't see that as a challenge, but for some people they may see it as a challenge because we are always on education, because it's so wide, because we work with different areas. For example, if you're on the floor and you work med-surg, you're going to have education on mostly med-surg patients. If you work like orthopedics, most of your education is going to be geared toward orthopedic patients. If you
Yeah.
work for psych, but we are like all in all. So we have a lot of education. We are always doing education, both internet education, webinars, conference. So we do a lot of education, and that is a lot actually as a virtual nurse, because you just have to understand all aspects of patient care with different kind of conditions, diseases, and how you want to take care of them virtually. So that is one big thing. Even with the company I work, they create special time for education. By the time they see you are lagging behind, you are not yet done, they give you time, like just take you off the work and make you focus on education so that you can update yourself and get done with it.
Okay. So that'll take me to the next question. You said the organization you work with. Is the organization an hospital, or they are connected to different hospitals that they can post you to as a virtual nurse?
Okay, the great thing about my company is one thing is, the first thing I want to say, this company is even held by a nurse. We call it a company that is established by a nurse for nurses. So they really understand the plight of a nurse. They understand how it feels to be a nurse. They understand things that could happen in our job. We really get burnt out in nursing. So this company really understand what the nurse feels in there, and they know how to deal with it, because this is actually established by a nurse for nurses to help our patients. So our company was established by a nurse, and what we do is to connect every hospitals in the United States and reduce workload on the bedside nurses, thereby reducing burnouts. Because sincerely, I've also been a bedside nurse and I know how it is, especially when you work on med-surg, oncology floor. There are some floors that are especially hectic. So this nurse sat down and thought of what can we do to help bedside nursing to be more efficient. And that's why virtual nurses is trying to take most of the workload off the shoulders of bedside nurses.
Okay. So if I understand what you are saying right now, that means even the patient you are seeing, they still have a physical nurse that is present.
Definitely. Nursing is there's no way you can practice nursing without a physical nurse. It's impossible. But we can have both the bedside nurse and the virtual nurse collaborate to take care of this patient to make things easy. And eventually we have a better outcome. These patients are much more satisfied. Let me give you
Wow.
an example. Bedside nurses are so busy sometimes, they don't even have time to wait at the bedside to talk to this patient. But for us as virtual nurses, we still have a lot of time on our hands. And most patients, even especially the elderly, they want to talk. They have something on their mind. They want to discuss issues. So we give them that time to talk to us. They explain what they need, their needs, their wants, what they wanted to tell the nurse that maybe the nurse they don't really have much time to actually sit and listen. So we listen to them, take their complaints and speak on their behalf to the bedside nurse or to
Wow.
other bedside professionals. That way, they are getting a better care and more satisfaction.
Okay. So now I want to ask what aspects of nursing, nurses do a lot of things. We do assessments, we do discharges, we do medication, we do patient education and all that. I know because as a virtual nurse, I can also have medication, of course. So
Definitely.
what aspects of nursing responsibility do you help these bedside nurses to do? Do you do
Okay.
admission? Do you do discharge? Do you do care plan, nursing care plan? Like, just give us some of the roles that you play virtually.
So the virtual nurses also have a lot of roles, although we cannot be there physically. So the first major role we do is admission. We do all admission paperwork. So once the patient comes in, the nurse just make them comfortable on the bed, send us a message. Although we have a system where definitely automatically I'm gonna know there's a new patient that just came in here, even if the nurse is not sending me a message. But they take that task upon themselves and say, okay, hey, there's a patient in so room. Can you please complete the admission? Do you understand? So we do admissions. So we do all the paperwork. We do discharges. On the bedside, sometimes the discharge can be delayed when there's a lot of work. So that makes us, within an hour of discharge order, the patient is out of the hospital. No more
Wow.
delays. So we do the discharge and patient education. This is something I really love because most times in the bedside, there's no time to actually sit down and educate this patient about their healthcare and even their diagnosis. And most times they still come back with the same condition because they don't even understand how to take care of themselves. So as a virtual nurse, we take our time and educate this patient on the condition, the medication, the diet. Sometimes it's just lifestyle changes that you need, exercise, what you're supposed to do after discharge. And that actually brought down the rate of being readmitted for the same condition. So we do education. And another important thing we do, safety. Safety in nursing is number one. We do rounding. So when we round on this patient, we check on them, we call into their rooms, ask them questions. Do you need help? We use the 5 P's: pain, potty, proximity of the call light. Sometimes I've called into a patient room and the call light is actually on the floor and she couldn't help herself. So I had to tell the bedside nurse,
Go
this patient
inside
needs
the
help.
patient's
And I'm going
room.
to stay on that screen until I see help coming for that patient. We don't just leave them. Do you understand? So we do that. And safety is, I've been on in a situation where I was talking to a patient. It's a patient that has when you have a room and we have 2 patients in it, and the other one just stood up and carried the chair and threw it on the other one. So what if, and the nurses were not in the room, they can't be there every time, but I was able to pick that, escalate the issue, and they came in at like 10, how we do in the US, like 10 people came in immediately, and they were able to rescue the situation. So virtual nursing is really there to help our patients, to help the nurses, and to make healthcare in general in the US much more efficient and effective.
Wow, I love this. Oh, I love this. There's no end to nursing
There's
in
no end to
Nigeria.
nursing. Virtual nursing is even evolving. I'm telling you, if you are the type that is not ready to like adapt to continuous change, you can't do this job. Because every day we are evolving, there are new things that are happening. The companies are introducing new things every day, and just have to match up. So if you are the type that you can't like, you are not flexible
Adapt
enough to adapt
easily.
to changes, I'm telling you, you're gonna drop the job. Like, you just have to be there, and you have to be eye up there to understand. We have a lot of meetings every week. Like, at least we have like 2 or 3 meetings in a week. New things every week. And we have a lot of hospitals on our hands. And you can't just work with one hospital. You might have like 4, you might have like 6, you might have like 5.
And they have
Yeah.
different
And
electronic
they have different
documentation.
EMRs. Yeah, they have different EMRs, they have different policies, So you just have to be there, be flexible, ready to adapt to a positive change, because it's so interesting. It's a very interesting part of nursing. So, and virtual
The way
nursing
you're
is
talking is like you like it, yeah?
that we are here to make America nursing hospital settings safe for all our patients.
Wow. So then, do you have to use your personal computers? Okay, you said you have office where everything
We
is
have
set up
where the
already.
office, everything is set up. The company makes everything available. Whatever you need, everything is available for you. I told you this company was established by a nurse for nurses, so they understand what we need and to make up comfortable while we're doing our job.
Interesting. So, but this people believe money is at the bedside. How is the pay that bad, or is it averagely okay, or is it very, very okay? So that means I'll come and do virtual nursing.
Let me say it's averagely okay. You understand? Well, for me, we have different companies that are doing this kind of virtual nursing, although I've not had the privilege, to work somewhere else or to know how they pay them. But for me, it all depends on what you want. Let me say that. To some people, they will say it's too low. Some people say it's average, So it depends on what you want. Because for me, whatever I'm doing that will make me have a work and personal life balance to the fullest, I don't mind how much you're paying me if I have my peace.
Even if I pay you $5 per hour.
It's not that bad. You wouldn't pay me $5 per hour to work for you as a virtual nurse anyway, but
I'm only
the pay
kidding.
is averagely okay, because you have time for other things. I mean, it's not as if you are not working when you're supposed to work, but you are not too tired to do something else. So while you are helping someone to build his or her own company, to establish the company, working as a team, you're also helping yourself to build your life, to build your future. Do you understand? So I think it's okay. Left to me, it's okay, averagely okay. At least you have time, even for your family, for your kids. You have more time on your hands. You are not too tired. When you understand, when you work on the bedside, especially when you work in a very busy floor. By the time you work the first shift, at least you have like 3 shifts as a full-time staff. You work first, second, by the third one, you are like very, very tired,
Or
But for
bedside
this,
nursing.
for virtual nursing, you can be going for 5 days and you're still good.
Is there opportunity for overtime?
Yes, there is opportunity. But what I see there is whenever there's an opportunity, maybe that because we have a lot of hospitals coming into virtual nursing, and they say, okay, we have this hospital, can you orient, can you just pick it up? So when you make yourself indispensable, they definitely, if you are indispensable, then they need you to do this job. So there's opportunity for overtime if you want it. But for me, I wouldn't say I don't do overtime, but I do it when I actually need it, because I so much believe in I love myself so much, and I believe money is not everything. There's opportunity for overtime if you want it, but if you don't want it, I'm cool with what I get anyway.
Wow, I love that. So has there been any time that you have technical issues, like you are already at work watching your patients and the system just go off? How do you troubleshoot? Do you have
Yes,
a
yeah.
technical team that you call? When the toilet
Mm-hmm.
is plugged, we know who to call. Like there are some phone numbers that you have handy to call to resolve issues. Do you also have that in virtual nursing? That
Yes, in
if you
virtual
have
nursing.
you have who to
mm,
call? Okay.
Yes, in virtual nursing, actually, this job has made me to be like, let me say, I won't say a super computer guru, but at least to some extent, what you do on a daily basis, that you understand if this happened, this is what I'm gonna do. And sometimes, when you don't even understand, you can simple tasks that you can check online and see, okay, what can I do? But when it gets, because I don't just call my IT like immediately. I want to try some things by myself, right?
Troubleshoot.
I want to troubleshoot by myself. So I do troubleshoot. I mean, the way they really establish the system is it's so okay that we really have issues, and we have access to IT techs with my company and even with the hospital we are working with. So we are actually on the work role of that hospital. So we have access to call their IT too. So which means that we have two IT
Support.
support apart from your own personality experience that you can do. So with that is a thing that has been settled. I mean, they really worked on that, and it is 24 hours. Anytime you call, someone is there to pick your call and put you through whatever is happening.
So let's go to collaboration in nursing. Do you just collaborate with the nurses in the local hospital, or do you talk to the doctors, the social worker, like interprofessional team, or you are strictly talking to the nursing department and the nurses on that unit? Has there been any time that you have to advocate for the patients? Like maybe the doctor puts in some orders and you feel this orders is not. Do you have access to the doctor, or you have to tell the local nurse to let the doctor know that the lab is this? Are they going to do something about it?
Okay, most of the time we do collaborate with a bedside nurse, but there's it's not as if it's compulsory. You can as well talk to the doctors, the physiotherapist, the laboratory technician. We can send, because we have system where a messaging
Health
system
chat,
and
yeah.
everybody is there. So if you decide to speak to the doctors, there's no harm in that. You can do that. But the best side is actually the first advocate for that patient. Even no matter what, even if the doctor is online, that you can message them, or even if the physiotherapist or MRI technician, the nurse still has to know what is happening no matter what. So I think that is why most times we do collaborate with the bedside nurse. But if the nurse now says, can you please go ahead and message, maybe for example, the clerk, we will collaborate with the clerk on the floor. Maybe I need the documents. Sometimes they can be very busy. They will just tell you, can you please let this person know? Can you inform? They give you the name, then you can go ahead. But most times, because that is how it works, the whatever issue we are having goes to the bedside nurse first before any
The,
other person.
the primary nurse taking care of that patient.
Yes.
So, oh, makes sense. Makes sense to me. Wow. So, in the case of emergency, though you've mentioned it, like a patient trying to hurt another patient that you have to intervene. So, in the case of emergency, do they prioritize calls coming from you in the hospital setting? Or has there been a time that you are calling the units and you have to keep on calling because nobody is picking your call?
They do prioritize our calls because we escalate issues. So if as a virtual nurse you are calling and maybe your call has maybe it's something emergency, even on the messaging system you can put like an urgent message that comes in red so that they could pick it up immediately. And if you made a call and you think this is urgent, maybe like the first ring, second ring, you can escalate to the virtual charge nurse. So it's not just
Okay,
the virtual nurse that is
so
working.
you
Yes,
still have charge nurse.
we do. So just like you are in the hospital setting, the only thing is that we are working from an office. We are not physically in the hospital. So we can escalate. So they all have the dedicated line. You know, when you see that kind of call, you want to pick it immediately that is something is happening. We have the child nurse, we also have manager. Do you understand? We have supervisor, we have manager. So it's just like we're on the floor. The only difference is we're not there physically. That's the only difference. It's just the same thing. And we run
the structure is still the same.
The structure is still the same because we run day shift, we run night shift, we often run mid shift. So whichever works for you. Yeah. It's still the same. Everything is the same.
So if you work overtime, it's still the same thing that applies to overtime in the hospital.
Yes, it's the same thing. Even with the health insurance, everything is the same thing.
I wanted to ask, you have benefits?
Yeah, we have 401k, we have PTO, we have health insurance, anything, everything. There's no difference, except that it's not the physical part of it.
That's why you don't pack poop.
You made me laugh. I know you cannot pack poop now on the camera. You can't do that. Yes, that's true. You can't do that. And that is why you are not getting paid like the bedside nurse, right? The pay is not as much as someone on the bedside. So the difference of the pay is still there, you know, and you are not as exposed to much infection. You are not exposed to infection. That's another benefit. Like during COVID.
Don't mention it. I want you to give me like 5 benefits. Because now I know you've worked as a bedside nurse in a very renowned hospital. I know that. And you know the kind of settings and everything there. And now that you're working as a virtual nurse, so I want you to tell me the benefits of working as a virtual nurse, because my audience is looking at you and some people might pick interest in it and say, wow,
yes.
A lot of people are burning out already. But then they love their patients. They want to still connect with patients. So how can I now, you know, join the two together? I'm burn out. I want to take care of patients. But you now, you have reached a balance. You are still communicating with patient one-on-one. You are still making that impact as a nurse. You know? A lot of people see this video
and I'm even making that impact.
The option. So tell me the benefits. I know you've mentioned some, and you can still have it so that
I will just start.
Part and the benefits that you see that you enjoy now that you are a virtual nurse as compared to when you are working bedside. Yeah.
Okay. So let me divide my benefit into 3 phases. Let me say for the patient, for the nurse, and for the hospital. So I will just put it under those topics to make it organized. So for the patient, they get a better care, they are more satisfied, they get more answers to their questions, they are well educated. There is a reduction in the risk of getting readmitted because they now understand their health condition better, and they feel loved, they feel heard, because as virtual nurses, empathy is number 1. So they feel heard and they are able to pour out their mind, and they get more information and they get more care. Most times I do a referral for social work for my patient, even while as a virtual nurse, they understand. So I do that referral for them, and when they tell me what their needs, so they get their needs met. So it means much more patient satisfaction and better outcome. For me as a nurse, and for whoever is a virtual nurse, you become a better version of yourself. Because for me, I've worked bedside and I know how burnout is. And sometimes unconsciously, if you are not very careful, you are becoming a kind of nurse you don't want to be. For example, let me just use that example, but because one way or the other, I still go to bedside when I want to. And I see because I can go there maybe once in a month. You can't compare to someone that comes every week, 3 days in a week, even sometimes 5 days in a week. Some people do that. You see the stress, they are tired, they are burnout. They get a little issue from a patient, they flare up. But for me, I know I've come today, I might not be coming tomorrow. Then I do
will get your best
the best out of me. then the nursing care is even much more better. Another thing is it has helped me with work-life balance, and I have more time on my hands to myself and to my family, and to do something else with my time. Do any other business, I have more time to monitor something else. So sometimes when you look at the pay, and if you have something like a side hustle, when you check it, you're still like, what I'm not getting on that side, one way or the other, I'm getting it from something else that I have time to do. So that's one benefit. And then it has maybe even have more impact beyond my local community.
Yeah.
So I have more impact because I work with different hospitals all over the United States. So one way or the other, I understand these states has more of this kind of patients, because the different states with different, even the conditions somehow a bit different. Some states have some things that are really common with them, while some don't have. Some states have more Black people, while some have more white people. So one way or the other, the impact is beyond my local community. Do you understand? So that is something that is very good for me. And burnout is to the barest minimum. It's to the barest minimum. It's only when you are doing too much overtime as a virtual nurse that you can get burnout with that. But you are the one looking for money, right? It's not as if you are forced to do overtime.
It's too much.
Yes. So that is when you can get really burnout. And another thing, I'm not exposed to infection. The rate of my exposure to infection is and that is also good when you have little children. You are not exposed to infection. You are not exposing your kids to and your family. Then for the hospital, a greater level of nurses retention. Those hospitals that has virtual nurses, their nurses don't get burnout easily because the workload has actually reduced. They are not bothered about discharges. They are not bothered about admission. They are not bothered about education. They are not bothered about patient rounding. Even we have virtual sitters that check on those that are confused. They are there 24/7 to watch them to prevent a fall. Do you see the kind of peace of mind those nurses are getting? So those hospitals will retain more nurses. Those nurses will work better. They are more efficient. Even if they work 3-4 days, they are more efficient because they are not being overloaded with too much work. What they are doing now is the physical care, making them comfortable. The paperwork is out of the way.
Wow.
So those hospitals has better patient evaluation of their care. Their patients have more satisfactions. Their nurses are happy and they are not burned out.
And they have value for the money they are spending.
Yes, there's value for the money they are spending. Yes, the patient
because they will have good rating, CMS rating.
Definitely. Even when I talk to my patient, they be like, "Do you have any questions, any complaints?" Because we do ask them. They will tell you, "You people are doing okay. You are doing great. Everybody has been good to me. The virtual, the nurses, the doctors, very good comments from those patients."
So now we've talked about benefits, how sweet this is, and all that. Do you want to tell us any challenge, whether at the beginning, middle, or?
There is challenge because when you are just being introduced to something new, definitely it's new to you. But for my company, we have backup 24/7, and we work as a team. You are not alone. If you don't understand something, just reach out, and someone is there to help you. Do you understand? So, and they give you full orientation. They make sure you are comfortable to do the job. Because sincerely, when something you have not done before, you'll be like, how would this patient accept me? How would they accept me even on the screen? Do you understand? So they give you full training, backup. Even when you are working, you are not alone. You can ask any question and they are ready to answer. But one other challenge I had is as an immigrant nurse, we have accents. there is accent. And you are talking on audio now, not physically. Sometimes even when you are physical, they will tell you, I can't understand what you're saying. Not talk of on the screen. So what I did is to overcome that challenge, because I don't see anything as a challenge for me, but I'm just trying to say those are
opportunity for growth.
For growth. So what I did is I looked for, there are some words when you say them, maybe because of your accent, they don't understand. You look for the most common way to describe that word that almost everybody understand. And so when you say it, they pick it up immediately.
Can you give me an example, please?
For example, you know, when you're doing admission, you want to ask them, where was the last time you had a bowel movement? That's to know if they are constipated and if they need intervention, is one of those questions we ask. So I would just tell them, when was the last time you pooped? They pick that. So if I use like, when was the last time you defecate? Or when was the last time you had a bowel? Sometimes even the elderly, you know, we have patients that are 90 years, 86 years. Some of them are, you know, out of hearing because of their age. And when you have those old elderly patients, you want to go slowly. You don't want to talk too fast so that they can pick your words. You're on the camera, you know. So you want to go slowly to talk to them. And so for that, you look for words that, you know, it's common and this patient can pick it easily. And one other thing is to work as a virtual nurse, you know, the bedside experience. You can't do it without a bedside experience. So even my company, yes, you need a bedside experience. Even my company or any other company, they won't employ you straight from school. No, they will not do that. They need you to show them that you have experience at bedside, at least 3 years and above. Because you need to pick up salient things. Sometimes you can have patients that are not breathing well. If you don't have experience, you might not be able to pick it on camera. So you need to pick those stuffs. Maybe you have a patient
you have to have that sixth sense.
Yeah, you have to have that experience. I've had a patient that as soon as I called in and he gave me consent, I knew he was calm on bed, on oxygen, but when he wanted to talk, he was trying to catch his breath. So I had to tell him, we'll do this later. And I had to just reassure him, let the nurses know to check on him, and then we'll call you back when you are much more better. But for a nurse that has not worked bedside and just want to do this straight from school, the nurse might not pick that. And if I keep talking to that patient might even, the oxygen level might even drop more. Because it needs just to be stabilized on oxygen at that time. Although he's alert oriented, he could answer questions, but just keep talking is making him getting short of breath. So we need to stop it at that time. So we watch all those clues. So as a virtual nurse, you are talking, you are watching, you are looking with your eyes, you are observing the environment. You want to know if it's a good time to talk to them. Don't just keep talking and ignore the non-verbal part of it. You don't do that.
So is there a recognition program in your facility where they recognize people that do well?
Yeah,
just like in the physical setting.
Yeah,
so there's some people that are doing quality control for what you have been doing.
Yes. We even do. We nominate like award, this Daisy Award. Everything I'm telling you, all you do on the floor, we do as virtual. We have Daisy Award. We have award for our virtual sitters. Everybody, there are awards for every aspect of the work, even the technical. You know, we have people at the technical aspect of the work. They have awards that they give them. Even the nurses on the bedside, they recommend nurses, virtual nurses for award. They ask them. So they recommend
us. Is there certification for this aspect of nursing?
For now, I'm not sure there's. There was a time I heard they're working on it. So very soon there'll be a certification for virtual nurses. But maybe to the best of my knowledge for now, I don't think there's any. But it might be, maybe we can find out, but I'm not really sure there's any. But I know it's something the United States in general is working on, because they actually have a plan. There's a reason for virtual nursing to help with the healthcare system in the United States. So they are working on making everything in place.
So from your experience, let's say they are doing pilot study now, you think it's worth it?
If there's something more than 100%, 150% is what it's worth it.
So
150%
what
because
advice do you have for my audience that are considering, or we that we are considering to be a virtual nurse in the future? What advice do you have for people that want to consider this aspect of nursing, maybe
okay,
now or in the near future?
okay. The advice I have is this. If you want to be a virtual, the first thing is you have to know what you want. Because sincerely, it's also kind of a bit sedentary. It's not something you are walking around, you are moving
I
your
wanted
legs.
to ask that do you have time for exercise so that we don't have
Yes, like we have training. Yeah, I understand. So we have training, the company train us. You need to stand, you don't just sit and just be there. You need to stand up, walk around, come back to your seat, because you need to stretch your legs, especially when you have a lot of admissions coming in. Then we have breaks. At least we have a 30-minute break, we have 2 15-minute break where you can stretch your legs. But the first thing for you to want to do virtual nursing is, do I really want this? Is this something I want? Then if it's something you want, then you can actually go into it. And you have to build your communication skill, because that is how you can sell yourself to the patient, that you can actually help them. We need to establish that rapport. They said first impression lasts longer. So when you are coming in, we are coming to represent your company. They're coming to represent that hospital with a very good impression on the patient, or else they won't accept you. When you come in with a bad impression, and you need to look good, you need to have your smiling face. You won't come and be frowning. You understand? So you need to have smiling face, good communication skills. That one is very important. Non-verbal, you have to be very good to pick non-verbal cues. And then you have to make sure you work with this patient to achieve their goals. You have to have a very good listening. You have to listen very good and help them to understand their health, and also help them. You have to be an advocate. You can't do without that. You are going to advocate for them to get what they really need as far as their care is concerned. So, and I think virtual nursing is a safe harbor for most nurses that they feel burnt out, they feel tired of working bedside, and so it's a very good aspect of nursing. And we also have room for progression. We move forward. We have different levels, different education, and even the company is even introducing something else, something very new. And for each thing they introduce, they need staff to manage that aspect. So there is room for you to grow. There is room for you to grow.
Thank you so much. Thank you. This is a high hope now. Thank you, thank you, thank you, thank you. I can't thank you enough, because even me, a lot of information that I'm hearing for the first time, and it makes sense for people to just have a view of what it is all about before going into it.
Yes.
I appreciate you. We are going to stop
You're
here.
welcome.
So my audience, don't forget to like, don't forget to share, don't forget to subscribe to this channel, and hit that notification button. Thank you, Dami.
You're welcome.
My
Bye-bye.
regards to your family.
Thank you. Thanks for all you do. Bye-bye.
Thank you. Bye.
Bye-bye.